Welcome back to our VoxLib Stax section, where I'm just saying. I'm your host, Dr. Premed, and today we're going to focus on reviewing scheduling methods as well as status of patients, both new and already established. Let's begin. Question 1. A patient calls to make an appointment with Dr. Evans. However, you notice in the system that the patient was last seen by Dr. Evans 3 years and 2 months ago. How should this patient be classified for scheduling and intake purposes? The correct answer will fall along the lines of new patient. Remember, if they were seen 3 years, 36 months, in 1 day or longer, this will classify them as a new patient, and they must complete full registration forms and a new demographic paperwork. Question 2. A medical office schedules 4 patients at the top of every hour. For example, every patient is scheduled at 9 a.m. and the clinic sees them in the order they arrive. Which scheduling system should this clinic use? Correct answer: wave scheduling. Look for the key phrases such as top of the hour or beginning of each hour. That there will be your day giveaway for wave scheduling. Question 3. Before setting up an electronic or paper appointment schedule, you as a CMAA must create a matrix. What is the primary purpose of establishing a matrix? Correct answer will follow along the lines to block out times when the physician is unavailable for patient care. Be sure to note that the matrix is set before any appointments are booked. On the exam, if a question asks what to do first when setting up a calendar, the answer would be establish/set a matrix. Question 4. An established patient arrives at the reception desk for a follow-up appointment. What should you do as the appropriate protocol regarding the patient's demographics and insurance? Correct answer will follow along the lines of verify existing information verbally and confirm if any changes occurred since the last visit. Remember this: new patients equals collect/create, and established patients equal verify/update. Recollecting full forms or established patients wastes time and creates duplicate EHR records. Question 5. A patient fails to show up for a scheduled appointment without calling to cancel. This is also known as a no-show. What is the most critical step that you must take? Correct answer is to document the no-show in the patient's medical record and EHR. If it wasn't documented, it didn't happen. Be sure to remember that phrase when looking at these types of questions regarding the no-show. Always document no-shows, cancellations, and follow-up outreach directly in a medical chart. Question 6. The dermatology practice reserves Tuesday mornings exclusively for skin biopsy procedures and Thursday afternoons for routine mole checks. As a CMAA, what type of scheduling format should you use? The correct answer would be cluster or categorization scheduling. Keywords like grouped together exclusively are reserved for procedure types, or similar conditions on specific days always point to cluster scheduling. Question 7. Which of the following documents must a new patient sign acknowledging that they have been informed of how their private medical information will be used and protected? The correct answer is Notice of Privacy Practice Acknowledgement, also known as the NPP acknowledgement. Question 8. If a patient complains of sudden severe chest pain and shortness of breath, what action should you as the CMAA take immediately? The correct answer would be to instruct the patient to call 911 immediately for emergency medical services. Remember, emergency equals immediate 911/triage protocol. Question 9. What is the most appropriate for medical practice to utilize double booking? The correct answer would be to accommodate an urgent patient who needs to be fitted into an already full schedule alongside a routine visit. Remember, double booking is reserved for urgent/same-day fit-ins, not routine scheduling. This concludes today's section, and I hope it helps. If you have any questions, be sure to leave them down in the comments. As always, take care of yourself first.